Welcome to Spinal Chat Deep Dive, a service of the Pennsylvania Chiropractic Association. Today's episode is called The Pill First Problem: Ibuprofen, Joint Pain, and Conservative Care. This conversation starts in a familiar place, the medicine cabinet. Many people wake up stiff, sore, and frustrated. They reach for ibuprofen because they want to move, work, parent, drive, sleep, and simply get through the day. That is understandable. This episode is not anti-medication. Ibuprofen and other medications can play an appropriate role in short-term symptom relief for some patients. Nothing in this episode should be taken as medical advice, and patients should always speak with their healthcare provider before changing how they use any medication. The better question we are asking today is this: what happens when the pill becomes the pathway? Modern musculoskeletal care is increasingly emphasizing non-drug, non-invasive, and conservative options first when clinically appropriate, especially for many spine-related and joint pain conditions. Movement, function, patient education, physical rehabilitation, and conservative care are not side issues. They are central to helping people live better over time. This deep dive is designed to help patients, healthcare colleagues, policymakers, employers, and the public ask a better question. Are we giving people real access to conservative musculoskeletal care before they are pushed toward medication-heavy or procedure-heavy pathways? Patients do not need fewer choices. They need better pathways. Let's dive in.
I want you to picture a scene, right? Like a scene that is probably incredibly familiar to a lot of us. You wake up, you swing your legs out of bed, and, well, the moment your feet hit the floor, you feel it.
Oh, yeah. That immediate sharp reminder.
Exactly. A stiff, aching lower back, or maybe it's a crackly protesting knee. So you hobble your way into the bathroom, open the medicine cabinet, and reach straight for that ubiquitous bottle of ibuprofen.
Right, which is completely understandable. You just want to function.
Yeah, musculoskeletal pain is so frustrating it completely disrupts your day.
You're just looking for that immediate relief, you know. We want the pain dial turned down so we can just, get to work or play with our kids or even just make breakfast without wincing.
Totally. So today we are taking a deep dive into what we're calling the pill first problem when it comes to joint pain. We're going to explore why the medical consensus is actually shifting rapidly away from that medicine cabinet and moving toward movement and conservative care.
And we really have a massive stack of sources for this one.
We do. We're pulling from recent Science Alert and Science Daily reports, the CDC's latest clinical guidelines, patient data from AARP, and even deep dive neurology studies out of Harvard, plus trial data from the Journal of the American Medical Association.
It's a lot of ground to cover to really figure out what is going on with our joints.
Yeah, but before we jump into all those studies, we need to establish a crucial baseline for you, the listener.
Right. And that baseline is that this deep dive is absolutely not anti-medication.
Not at all.
Ibuprofen and other drugs, they have a very valid place in short-term pain relief. We are not telling you to throw out your medicine cabinet.
Please don't do that.
Yeah, don't do that. Rather, this is a pro-access, pro-function, and pro-conservative care discussion. And, as always, you should speak with your healthcare provider before changing how you use your medications.
Okay, let's unpack this. Let's look at the actual mechanics of why we reach for that bottle of ibuprofen in the first place and, what it's actually doing to our bodies.
Right, so ibuprofen belongs to a class of drugs called NSAIDs.
Non-steroidal anti-inflammatory drugs.
Exactly. They're cheap, they're everywhere, and they are generally effective for acute flare-ups because they temporarily reduce inflammation and swelling.
But it's important to understand how they achieve that.
Yeah, so when you injure a joint or you have an arthritic flare-up, your body produces these chemicals called prostaglandins.
Prostaglandins, okay.
Right. These chemicals are the messengers that promote inflammation, pain, and fever. So what NSAIDs do is they work by blocking the specific enzymes that create those prostaglandins.
Ah, okay. So the inflammation goes down and the pain signal just doesn't reach your brain with the same intensity.
Exactly. You mute the signal.
But when we look at the long-term logic of using these every single day, it starts to look a bit, flawed. I like to think of treating chronic joint pain with daily NSAIDs as basically putting a bucket under a leaky roof.
Ooh, that's a great analogy.
Right, it catches the water so your floor doesn't get ruined today, which is a relief, but it does absolutely nothing to fix the hole in the roof.
You aren't addressing the underlying joint deterioration at all.
Exactly. But I want to play devil's advocate here for a second.
Sure, go for it.
I can go to the grocery store right now and buy a massive bottle of 500 ibuprofen pills for $8. If they are sitting right there on the shelf next to the breath mints, Shouldn't that inherently mean they are exceptionally low risk for daily use?
It's a very common assumption, but, and we really have to stress this, over-the-counter does not mean low risk.
Right.
What's fascinating here is the sheer biological toll these medications can take on your system when you use them frequently or long-term. And this goes back to those chemicals we just talked about.
The prostaglandins, the pain messengers.
Yes, but pain messaging isn't their only job. Your body is incredibly efficient. Those same prostaglandins that cause pain also happen to be responsible for maintaining the protective mucus lining in your stomach.
Wait, really? The exact same chemicals?
The exact same ones. So when you take an NSAID to block the pain in your knee, you are simultaneously blocking the maintenance of your stomach's protective shield.
Oh, wow.
Yeah. This is why frequent use significantly increases your risk for stomach ulcers and internal bleeding. And the scary part is, some people don't even notice symptoms like indigestion until a serious, life-threatening bleeding event actually occurs.
That is terrifying. I know the Science Alert piece specifically notes that this risk goes way up if you're taking high doses, like around 2,400 milligrams a day or more, or if you're over the age of 65. But I was surprised to read that the gastrointestinal tract isn't the only system affected. What is happening with the kidneys?
This is another massive overlooked risk. Prostaglandins also play a critical role in your renal system.
Okay.
They are the chemicals responsible for keeping the blood vessels in your kidneys wide open so blood can flow in and be filtered properly.
Oh, I see where this is going.
Right. When you take daily NSAIDs, you are blocking that mechanism, which dangerously constricts healthy blood flow to the kidneys. If you happen to be dehydrated or you have existing kidney disease, you can severely injure those organs.
That is wild. So the over-the-counter pill you are taking for your lower back is actively restricting the blood vessels in your kidneys.
Yep. And the systemic effects just keep cascading, honestly. Long-term NSAID use is associated with raised blood pressure, fluid retention, and even an increased risk of heart complications.
And didn't the source say it affects the respiratory system too?
Yeah, actually. Some people with asthma are highly sensitive to NSAIDs and can experience sudden wheezing or severe breathing difficulties.
Because the drugs alter that natural chemical balance in the airways.
Exactly. It's all connected.
Well, I was reading the piece from AARP, and it brought up a really good point about compounding risks for older adults. Like, if you're dealing with chronic joint pain, there is a very high likelihood you might be taking other medications as well.
Oh, the medication interactions are a huge concern. If you are taking ibuprofen alongside blood thinners or certain antidepressants or blood pressure medications, your risk for severe adverse complications just skyrockets.
And there's a structural consequence mentioned in the sources, too.
You're talking about the fall risk study.
Yeah, that 2015 National Health and Aging Trends study. They looked at community-dwelling Medicare beneficiaries and found that older adults with arthritis who take pain medication every single day have a significantly higher risk of falling.
Which is, I mean, it's terrifying. A fall for an older adult can mean a broken hip, a hospital stay, and a permanent loss of independence.
You are taking a pill to help you move safely, but statistically it is increasing your chance of a devastating physical accident.
And what happens when the patients realize the pills are losing their effectiveness or they start causing stomach pain? They look for alternatives.
Right.
The traditional medical route used to escalate straight to prescription opioids, but the data has turned fiercely against that.
Yeah, there is a study in the BMJ Evidence-Based Medicine Journal we looked at.
The one about tramadol?
Exactly. They looked at prescription opioids like tramadol for chronic pain, and they explicitly stated that the limited pain relief benefits were completely outweighed by the severe harms.
Things like addiction and respiratory depression.
Right. They basically said its use for chronic non-cancer pain needs to be entirely reconsidered.
Which leads perfectly to the FDA warning in our sources.
Oh, man. I actually had to read this FDA warning twice because it sounds almost criminal.
It really does.
So when standard pills stop working and doctors are reluctant to prescribe opioids, which makes sense, people get desperate. They turn to the quote-unquote all-natural or dietary supplement market.
Right.
People buy these imported arthritis supplements, sometimes under names like Umuri or T1 Lyre, thinking they are getting a safe herbal remedy.
But the supplement market is incredibly underregulated compared to pharmaceuticals.
Exactly. And the FDA found that many of these all-natural joint pills are secretly contaminated with hidden, dangerous prescription drug ingredients.
They're literally spiking the supplements.
Yes, spiking them with powerful, unregulated doses of NSAIDs or corticosteroids just to make the customer think the herbs are working.
Which brings our risk conversation full circle. Think about it. If you are already taking a daily NSAI, and then you add an all-natural joint supplement that is secretly spiked with hidden NSAIDs.
You are unknowingly double dosing.
Exactly. You are pushing your stomach and kidneys into incredibly dangerous territory without even realizing it. The pain is real, and the desire for relief is completely valid, but the quick fix in a bottle is just riddled with risks. We have to fundamentally rethink how we treat the joint itself.
Okay, so if the pills are just muting the fire alarm, we need to look at the actual fire. And that brings up a concept I hear all the time, wear and tear. We treat our bodies like machines, you know? We assume that joints are like the tread on a car tire, and the more miles we put on them, the more the cartilage inevitably grinds away until it's just bone on bone and we need a joint replacement.
It's a very pervasive myth.
What?
But biologically, it is entirely inaccurate.
Wait, really? It's not just wear and tear.
No, not at all. Osteoarthritis, which by the way affects nearly 600 million people globally, is categorized now as whole joint disease.
Whole joint disease.
Right. It doesn't just involve the cartilage eroding. It involves the underlying bone restructuring, the joint fluid changing, the ligaments loosening, the surrounding muscles weakening, and the nerves actually becoming hypersensitive.
That's a lot more complex than a bald tire.
Let's focus on the cartilage for a second, though, because the underlying science here completely changed how I think about my own knees.
Fascinating stuff.
So cartilage is that smooth, slippery tissue cushioning the ends of your bones. But here's the kicker. Cartilage does not have its own blood supply.
Right. It is an avascular tissue, meaning it has no veins bringing it oxygen and food, and no veins carrying away cellular waste. It relies entirely, 100%, on physical movement to survive.
It absolutely requires mechanical loading to function and maintain its cellular health.
So I like to think of your cartilage like a thick, rigid sponge sitting inside your joint fluid.
I love the sponge analogy.
Yeah. If a sponge is just sitting on the kitchen counter, what happens? It dries out and gets brittle. But when you walk or put weight on that joint, you are stepping on the sponge. You compress it. That compression physically squeezes all the old waste-filled fluid out of the cartilage. Then, when you step off and take the weight off, the sponge expands. It creates a tiny vacuum that sucks in fresh, nutrient-rich fluid and natural lubricants from the surrounding joint capsule.
Every single step you take is essentially a mechanical meal for your cartilage.
A mechanical meal. I love that.
And that mechanism explains why movement is quite literally the best medicine for joint pain. Without that regular compression and release, the cartilage starves, it dries out, and it degrades at an accelerated rate.
Okay, I have to stop you there and push back a little because I know what the listener is thinking.
Sure.
If my lower back is locked up, or my knee is absolutely screaming in pain, my body is sending me a very clear signal to sit down on the couch and not move. Isn't it completely counterintuitive and potentially damaging to force a screaming joint to exercise?
It feels incredibly counterintuitive. Yeah. And look, if you acutely sprain your ankle, yes, you need to rest it for a few days to let the acute tissue damage heal.
Right, acute injury is different.
Exactly. But with chronic musculoskeletal pain and osteoarthritis, resting is actually what accelerates the long-term decay.
Oh, so.
If we connect this to the bigger picture, we have to look at the muscles. One of the earliest warning signs of osteoarthritis isn't bone changes, it's muscle weakness around the joint. If you rest chronically, those muscles atrophy.
They shrink and lose their tone.
Right. And when the muscles are weak, they can no longer support the joint structure. They stop acting as the primary shock absorbers.
Oh, man. So all the impact goes into the joint?
Exactly. All of that mechanical pressure from walking or standing goes straight into the already compromised cartilage and bone. But by engaging in targeted resistance and aerobic exercise, things like brisk walking, cycling, swimming, or Tai Chi, you are strengthening the muscles around the joint.
You are rebuilding the shock absorbers.
Precisely. And that takes the immense mechanical pressure off the cartilage, allowing it to, quote-unquote, breathe and function normally without being crushed.
There is a massive weight component to this pressure, too. The AARP source highlighted a stunning piece of biomechanics from Cedars-Sinai.
This stat is always shocking.
Losing just 1 pound of body weight takes 4 pounds of force off the knee. 1 pound equals 4 pounds of mechanical relief.
It's incredible math.
If someone manages to lose 10 pounds, that is 40 pounds of pressure removed from their knee with every single step they take.
And the benefits of movement and weight management aren't just mechanical either. They're deeply metabolic.
Metabolic, how do you mean?
Well, adipose tissue fat isn't just inert weight hanging around. It is metabolically active. Obesity and a lack of movement are strongly linked to higher levels of systemic inflammatory molecules circulating in your bloodstream.
Like cytokines.
Specifically cytokines, yes. These molecules actively degrade and eat away at your cartilage on a cellular level. But regular physical activity counters this. It lowers the systemic inflammatory markers in your blood, effectively turning down the heat on that kitchen fire we talked about earlier.
Here's where it gets really interesting, though. If movement, physical therapy, weight management, and exercise are the absolute gold standard for treating joint pain and saving our cartilage sponges, why isn't everyone doing it?
That is the million-dollar question.
Right. Why is the medicine cabinet still the default? We have a massive disconnect between the clinical science and the reality of our healthcare system. Global studies show that less than 50% of osteoarthritis patients are ever prescribed exercise or physical therapy by their primary care provider.
Less than half.
And instead, a staggering 40% are referred to orthopedic surgeons before they've even tried a single non-surgical option.
We are dealing with a systemic pathway problem in modern medicine. You really have to consider the structure of a standard primary care visit.
Because they're so short.
Exactly. A doctor often has like 15 minutes to assess a patient, make a diagnosis, and offer a solution. It is incredibly easy and fast to write a prescription for an NSAID or to write a referral to a surgeon.
But it takes way more time to explain all this sponge stuff.
It takes far more time, education, and patient coaching to explain the biomechanics of cartilage and prescribe a multi-week course of physical rehabilitation. But the top-level clinical guidelines have completely flipped to recognize this failure.
Yeah, the sources are very clear on this. The medical consensus has shifted dramatically away from the prescription pad. The CDC's 2022 guidelines for prescribing opioids and the American College of Physicians' 2017 guidelines both explicitly demand that doctors recommend non-pharmacologic, non-invasive treatments as the absolute first line of care, particularly for massive drivers of disability like low back pain.
They are telling the medical community, you must exhaust physical conservative therapies before you move to pills or scalpels.
Which is a huge shift.
And one of the primary conservative therapies explicitly recommended in those guidelines is spinal manipulation.
Which brings us to the role of chiropractic care in this modern puzzle. When people hear conservative care for musculoskeletal pain, physical therapy is usually the first thought.
Right, PT's great.
But chiropractic care is a massive piece of this, particularly for spine-related issues. The American Chiropractic Association highlights that the strongest evidence we have for chiropractic treatment is specifically for the low back and the neck.
And the data backing this up is incredibly compelling, coming from some of the most rigorous institutions in the world. We aren't looking at small anecdotal surveys here.
Give me an example.
Well, a major clinical trial published in the Journal of the American Medical Association looked at 750 active-duty military members.
Active-duty military puts an unbelievable mechanical strain on the human body.
Oh, absolutely, particularly the spine. The trial found that combining chiropractic care with usual medical care provided significantly greater pain relief and improved physical function compared to just giving those soldiers standard medical care alone.
I want to stop and look at the actual mechanism of that relief because I'm looking at this Harvard Medical School research in our stack, and I'm going to be honest, it sounds a little out there.
The brain modulation stuff.
Yes. It suggests that spinal manipulation actually changes how the brain processes pain. We're talking about a chiropractor physically moving a joint in the back, and the result is an alteration in the brain. How does that even work?
I know, it sounds like science fiction until you look at how pain actually functions. Pain isn't just a signal traveling up a wire from your back to an empty receiver.
Right.
Pain is constructed and processed by complex neural networks in your brain. So the researchers at Harvard use functional MRI scans to look at the brains of patients with chronic low back pain before and after spinal manipulation.
And what did they see?
They discovered that the physical treatment actually modulates the brain's functional connectivity. Specifically, it altered the communication between the brain's default mode network and the regions responsible for the cognitive and sensoromotor processing of pain.
So by physically restoring the movement in the spinal joint, you are essentially rewriting the corrupted data in the brain's pain processing center.
Exactly. You're helping the nervous system recalibrate so it stops interpreting normal physical loads as a severe threat.
That is fascinating.
And when you address the neurological and mechanical root of the pain, the reliance on chemical masking drops exponentially. This is perhaps the most vital data point in our entire deep dive today.
Let's hear it.
A comprehensive study published in the British Medical Journal tracked patients with new-onset low back pain. They found that patients who see a chiropractor as their initial provider have a staggering 90% decreased odds of early and long-term opioid use.
A 90% reduction.
Yes.
That is a massive decrease in exposure to highly addictive, dangerous drugs simply by changing the pathway of who the patient sees first.
Right. If they start with a conservative care provider who focuses on movement and biomechanics, they almost entirely bypass the opioid pipeline.
Because you're actually fixing the roof instead of just putting down a bucket.
Exactly. When you treat a mechanical issue like a locked spinal joint or a starving cartilage sponge with a mechanical solution, rather than trying to mask it with a chemical one, you drastically reduce the need for high-risk medications. You restore the function, which lowers the pain, which eliminates the need for the pill.
So what does this all mean for you listening right now? It means that the era of modern musculoskeletal care is in the middle of a massive shift. It is moving away from the surgeon's table, and it is moving far away from the quick-fix pill bottle. The science is pointing us towards supported, guided, conservative therapies that restore your body's natural function. Yes, musculoskeletal pain is a heavy, exhausting burden. But masking it continuously with ibuprofen comes with hidden systemic risks to your stomach lining, your kidneys, and your cardiovascular system.
True joint health doesn't come from a pharmacy shelf. It comes from feeding those cartilage sponges through consistent movement. It comes from strengthening the surrounding muscles through targeted physical therapy and utilizing conservative therapies like chiropractic care to maintain spinal function and modulate how your nervous system processes pain without drugs.
Absolutely.
Patients do not need fewer choices. They need better pathways.
Yeah.
And for many people living with musculoskeletal pain, conservative care should be easier to access, not harder.
That brings everything together perfectly. But before we wrap up this deep dive, I want to leave you with one last, slightly provocative thought to mull over.
Oh, I like these.
We spent a lot of time talking about how your cartilage literally requires the physical compression of walking and moving just to pull in nutrients and survive.
Right, the sponge effect.
Exactly. If that is the strict biological truth of how human bodies operate, maybe the modern epidemic of joint pain isn't actually a medical failure of aging at all. Maybe it is an architectural failure of our modern lives.
Oh, that's interesting.
Right. What if we redesigned our offices, our homes, and our sprawling commutes so that spongy joint movement was a mandatory, unavoidable part of merely existing in our spaces, rather than a 30-minute chore we have to schedule at the gym?
That completely flips the perspective.
So tomorrow morning, instead of waking up feeling stiff and shuffling to the medicine cabinet for a pill, maybe the best possible thing you can do for your joints is to just keep walking.
This episode is a service of the Pennsylvania Chiropractic Association. The point is not that patients should avoid medication. It is that long-term joint and musculoskeletal health rarely comes from a pharmacy shelf alone. Medication may help quiet symptoms for a time, but function, movement, strength, mobility, and access to conservative care matter deeply. That is why this conversation matters beyond the exam room. It matters for patients who want to stay active. It matters for medical colleagues looking for responsible referral pathways. It matters for employers managing the cost of musculoskeletal pain. And it matters for elected officials making decisions about access, scope of practice, delegation, and benefit design. The strongest chiropractic evidence is in spine-related pain, especially low back and neck pain. That is an important lane, and it is a powerful one. When patients can access conservative care earlier, they may have better options before care escalates to higher risk or higher cost pathways. Please share this episode. PCA Deep Dive episodes are meant to be used as educational resources for patients, medical colleagues, legislators, employers, staff, and the public. Share them on social media. Use them as conversation starters. Help us explain why conservative musculoskeletal care matters. If you are a chiropractor in Pennsylvania and not yet a member of the Pennsylvania Chiropractic Association, we invite you to join us. PCA is working every day to protect the profession, expand access to conservative care, educate the public, and advocate for a stronger future for chiropractic in Pennsylvania. Chiropractic remains one of the most underused resources in our health economy. The more clearly we explain it, the more future patients we can reach. Until next time, thank you for listening.